Dr. Harden. Thank you, Tricia. Nice for some feedback. Dr. Harden, the floor is yours.
Thank you very much, Marion. Everyone, it's really nice to be with you today. I'm hopefully going to be able to give you some useful insights from my perspective. So I'm the Deputy National Clinical Director for Scottish Government. I unfortunately have the benefit of working and the commiseration of working with Professor Leach. That's my penance, not anyone else's. But as part of that kind of senior clinician team, we feed into the advice to ministers around all things to do from a public health perspective with relation to COVID and beyond. First thing I'd like to say is sorry, it wasn't my fault. Regarding the kind of level 4 restrictions that are just about to be introduced across the central belt of Scotland. But I hope after I've spoken this morning or this afternoon, you'll understand why we've had to take those steps and the rationale behind them. So I think I'd just like to kick off by giving a bit of an overview of where we are in this whole pandemic business. So back in December, believe it or not, so it's almost a year that we've had this virus floating around the country or the world. First starting off in China and then spreading throughout the rest of the world over time. Generally, we probably started to see the first cases in February in Scotland, and then we obviously had to take the more immediate steps towards the end of March with the first wave lockdown to try and stifle the spread of the virus. And since then, you know the story. You've seen us come out of lockdown, you've seen us gradually try to ease those restrictions, but you've also seen how opportunistic this virus can be. You've seen how it takes the opportunity to reinfect people, to infect others, to spread its tentacles out and involve wider parts of the population. But during that time, science has moved on at an amazing pace. Medicine has moved on at an amazing pace. And in that time, I've been a doctor for 25 years nearly now, and I've never known medicine to be changing as rapidly as it has. I've never seen the NHS in my 20 odd years of being in and around it change so much so quickly to rise to meet the challenge that it did. Just to give you a bit of an example, I still practice clinically on a Thursday in my A&E department in Lanarkshire. And I go there for a bit of respite from the government, which is quite nice. But I also go there to keep in contact with my clinical skills and expertise. And when I'm back in my clinical practice, I see those changes that's happened right up front. I see the benefits that happen. I see the treatments that we've now got to help us with the virus. I see the benefits of the new care plans that we've got to try and treat people at a different stage. And we're seeing less people getting admitted to intensive care. We're seeing more people getting discharged from hospital after the effects of the virus. Unfortunately, we're still seeing deaths. I'm afraid to say we're still seeing deaths. But we're doing a lot to try and kind of reduce those number of cases as much as we can. So what do we know now about the virus that we didn't know back in March, back in February? Well, we know how it spreads. It spreads by droplet spread. What does that mean? It means that small bits of spittle come out your mouth when you breathe. The virus is in those little droplets, and in the main, they fall to the ground. So if you're wearing a mask, the mask catches a vast majority of them. Now, we wear surgical masks, fluid-resistant surgical masks in clinical practice. They catch about 90% of it, okay? When we're doing procedures that are more intense, we wear really tight-fitting masks, and they catch about 99% of it, okay? But your face coverings still catch a considerable amount, a proportion of it, roughly in the region of about 50 to 60% of it. So that's why it's important that wearing a mask is vital, because it stops that first line of transmission. It catches the virus as it's coming out of you if you happen to have it. Your mask doesn't protect you though. Your face covering doesn't protect you. You're wearing it to protect others from you. And therefore you need to have that altruism with each other, that kind of shared responsibility with yourself, those you are working with, those your colleagues and friends and family, that they then wear a mask to protect you. Okay, so that's the important thing about wearing a mask. We also know that when the virus is in the atmosphere, in the air, after it comes out of your mouth or your nose, it does sometimes hang about a little bit in an aerosolized form. Now, in the main, that will eventually fall to ground or be blown away in the air. So that's why outside is okay. But that's why inside with poor ventilation or in confined spaces with lots of people start to make it a bit harder, and the virus starts to hang about a bit longer. So that's why we ask people to wear the mask and open the windows when they're inside and increase that ventilation through flow, so that the air is constantly moving and changing and so on and so forth. What else do we know? We know that the virus seems to affect those at the top end of the age scale much more than it does those at the younger end. That's not to say it doesn't affect you, but we just know that people, as they get older, they get more conditions associated with themselves. I mean, whose granny isn't on a box of tablets, every day? So that's a sign that you've got more conditions building up in your system that impact on your ability to recover and respond to disease. And therefore, we see the more elderly population be more susceptible. We also see those people who have pre-existing conditions, such as the people that we asked to shield in the first half. They're more likely to have poor outcomes from it. But we even know more about that population now. And actually, that's why the shielding guidance is different now. So in level 4 just now, we're not asking those people that shielded to lock themselves away in a cupboard. We're asking them to live life as much as they can, but be extra cautious, to be mindful of when they go back to work. Are all the mitigations in place that they can do? When they're meeting with people, that they make sure they're wearing masks and keeping that 2-meter social distancing. We also know about the kind of BAME communities. And initially we were worried that there might be some genetic component. It's not there. That genetic component isn't there. It just seems to be that people who are in that BAME community tend to be slightly more likely to live in conditions that are more crowded or closer family, multi-generational households, that they tend to, in the main, and I'm generalizing here, I'm not saying specifically, but in the main, they tend to have more public-facing jobs, that kind of thing. So that seems to mean that their exposure's higher or their other wider risk factors are higher. And we also know that people in the lower socioeconomic classes seem to be affected more. So poverty seems to be a big issue. So people who are on the poverty line or below the poverty line, or who have got poor social housing or whatever, they struggle with this, and it seems to affect them disproportionately as well. So whilst we talked previously about it being a leveler, there may be some instances where it actually widens that inequalities gap in some cases. So it's just to have that in mind when you're thinking about the virus itself. What I'm essentially saying here, though, with all of that background, is that's why we've got facts. Okay, that's why it's really important that you wear your face mask or your face covering. It's why you should avoid crowded spaces. It's why we need to clean our hands and our surfaces as we're directed to do. That 20-second hand washing technique that I learned when I was a medical student still holds today. Okay, 25 years later, in fact, I've had to go on a wee refresher course for it to make sure I'm right. But it's really important that you wash your hands properly for the 20 seconds and that you wipe down all your surfaces as regular as you possibly can. Using general domestic cleaning products is absolutely fine. Some places want to go the whole fancy hog and buy all the expensive stuff. It's up to you. But keeping everything nice and clean and regularly wiped down is more important. Okay. The kind of other bits of facts are that 2-meter distancing. So trying to maintain that 2-meter distancing as much as you possibly can. And if you think you're at 2 meters, you probably aren't quite at 2 meters. So a wee extra step back. Okay, I find myself gravitating towards colleagues when I'm at work, just because you're worried that they're not hearing you because it's noisy and you're wearing a mask. So just be conscious of, am I actually 2 meters, and just over-egg it and take an extra step back. And then ultimately, why we've got that whole thing about self-isolating and getting a test when you think you've got symptoms is because we want to remove people who are positive from that community engagement. So you want to isolate yourself and then get a test to prove whether you've got the virus or not. And it's vitally important that you adhere to that. That then feeds into when you are doing your job, when you're trying to deliver the services that you provide to those that you're serving. And that's where that risk assessing is really important. When you're going to do a task or a job or a teaching episode or whatever it is you're involved in, a community group or whatever, risk assess it and say, can I do it bearing all that stuff that Harden's just spoken about in mind? Can I keep social distancing? Can we do it with masks on? Can we wash our hands? You know, and have I got a process so that I know somebody who might have symptoms doesn't come and self-isolates and goes and get a test and all this kind of stuff. So have that risk assessment process in place, and just take a moment to think about it before you jump in. I just want to talk a little bit about those pesky levels that we've just all put in place. Okay, the 5-tier system that we've talked a lot about. So we've just seen for the first time us use that level 4 close to lockdown strategy across West Central Scotland and some other areas. What that process is effectively trying to do is cut off that opportunistic type of action that the virus takes. Okay, so I've talked a bit there about how the virus spreads, that kind of opportunistic action that it takes. So what the tiers do is, as you go up the tiers from 0 to 4, we try to cut off the opportunities for the virus to spread. So we reduce the number of people you can mix with. We reduce the opportunities that you have of places to go where you might meet other people to spread the virus. And we also put in those other mitigations that prevent you travelling about, and if you were positive, sharing the virus around. Okay, so that's why it's important that as you move up the levels, it's trying to cut off the opportunities that the virus has for spread. And we've seen that we need to go to those levels where the virus is in high prevalence and it's not coming down, because obviously the opportunities are too much for it to continue to spread within the community. Therefore, we need to back off and limit it. Whenever we make these decisions, we base them on the prevalence data around the virus activity, the impact it's going to have on the health service. But you may have also heard of a thing called the 4 harms. So the 4 harms that we talk about are the direct effects of COVID on your health. So how many people are getting the virus, how many people are in hospital with the virus, and how many people are dying from the virus. Okay. The second harm is then that wider impact on health and social care services. Okay, so how are people accessing the services? What pressure is in the system because of the extra burden from COVID? So if we've got healthcare systems that have got lots of patients going into them from COVID, then they might not be as able to do the normal services that they would provide because of that. So that's the second harm, is what's that other consequences that's happening, not because of COVID directly, but on other bits of the system. And then the third harm is the social harms. How much harm are our actions taking on you being able to live your life and have a healthy and good life as much as we possibly can? So are you able to mix with family and friends? Are you able to meet with the people you need to see? Are you keeping your own mental health up? Okay. And then the fourth harm is that economic harm, and we're all hearing lots of things about the impact on the economy, the impact on the ability of businesses to continue trading, and that's always a concern of ours. And we always take into consideration those 4 harms as we make a decision around what levels people need to go in. Ultimately, the aim of the process is to save lives, okay, to protect our services, and I mean not just the NHS, but the NHS and the social care services, so that they can cope with people. But we need to take into consideration that economic and social aspect there as well. Lastly, I just want to kind of draw a conclusion come to conclusion around what the future might hold. Okay, so what's the future going to hold? So you might have seen lots of kind of excitement about vaccines. Okay, and lots of excitement about the future and what vaccines allow us to do. Just a little word of caution. Yes, it's fantastic news that we're going to have vaccines, and we're going to have vaccines that can provide what look like really high levels of effectiveness in the population. I would just, a little word of caution there is that it's not over yet. Okay, when the vaccines come, there may be logistical issues with us being able to deliver them to people. There may be issues about how long it takes us to deliver them to everybody that needs to get them, and then beyond getting them to everyone else, okay? And then the last thing I would say is that these restrictions on this virus aren't going away anytime soon. Therefore, even with a vaccine in place, there's going to be a lag time before we're able to remove any restrictions or all restrictions. And then ultimately this virus is going to be with us for a while, okay? Flu's never gone away. There's only been one disease that we've ever managed to eradicate, and that's smallpox, okay? So just bear that in mind. We thought we had measles licked. We thought we had polio licked. No, we didn't, okay? And we still don't. So just have that in mind. Yes, it's fantastic news, and I really hope it will be fantastic news, but just to make you aware that we'll be living with this virus for a bit longer. And thanks for listening.